All right, folks, a lot of questions about norovirus because we're seeing some outbreaks in Western Canada. So what do you need to know? So this is a very common virus. It's the most common cause of gastroenteritis symptoms, hundreds of millions of cases a year, probably about 1 million cases just in Canada. We saw a little bit less of it during COVID times because, like every other infectious disease, we were careful. We were keeping our distance, we were washing our hands, so there was less of it. We're not seeing any more of it this year than we typically see in a pre-COVID year, but there have been a few outbreaks. And how do those outbreaks occur? So this is a gastrointestinal virus, so you shed it in your stool. And if you are using water that's contaminated with sewage that had the virus in it, in any food processing industry, you can get outbreaks. So the example with what we have in British Columbia now with an outbreak related to oysters is that those oysters were probably harvested from water that was contaminated with the virus, and you will often get outbreaks in fruits and vegetables because those fruits and vegetables were actually irrigated with water that was contaminated with the virus, and you don't need a lot of this virus to cause an outbreak. So we will get a lot of these foodborne outbreaks that you will hear about where you'll get recalls when we discover these. And then once you get that outbreak, there's a lot of person-to-person spread because, again, it spreads very easily. And it's a very hardy virus. It hangs around on surfaces. It's very easily spread through food, so sharing utensils, sharing food. And it's hard to kill. Even those alcohol sanitizers don't work particularly well, so you really need to wash your hands with water and soap. The typical symptoms are stomach cramps, nausea, vomiting, and diarrhea. You will often get sick within a day or two, sometimes as early as 12 hours after exposure. The good news is that you will usually only be sick for a few days. People are able to expel the virus and your body can overcome the virus. The biggest risk is dehydration while you're sick, particularly for the very old and the very young, so be aware of that. Keep hydrated if you're sick with this. There is no other specific treatment for it other than keeping hydrated and keeping away from other people so you don't spread it. If someone in your household has these kinds of symptoms, don't share their food, don't share utensils, keep your distance, and make sure they wash their hands with soap and water and you wash your hands with soap and water often, and you'll get through it. So norovirus, nothing new and nothing particularly dangerous, but you don't want to get it.